So first of all, what is a neuropsychologist? So a neuropsychologist is a Ph.D. level professional who specializes in neuropsychology. So now neuropsychology means we're interested in how the brain is working, whether that's for an adult or for a child. But either way, we're interested in how the brain is working and how it specifically, what kind of impact it's having on cognitive functioning and behavior. So we're going to be taking a look at, when we talk about cognitive functioning, we're going to be talking about things like attention and language, what we call executive functions, which are things like reasoning or inhibition or multitasking, planning, organization, things like that. Language, visual motor skills, hand-eye coordination, things like that, and memory. When we're talking about behavior, we're talking about things like diagnoses. Things that have to do with like attention span and restlessness and impulsivity and more unusual behaviors, maybe like oppositional behaviors, autistic behaviors, things like this. And usually we're also interested in academic functioning too. So we're talking about how a person's doing in school. Now, what is a neuropsychologist? Well, we have to get that training. So first of all, we have a Ph.D. Typically in psychology, whether it's counseling psychology or neuropsychology or clinical psychology. But typically afterwards, during our training, we do some externships and internships, which are training exercises in the area of neuropsychology. And then afterwards, we usually do a postdoc in the area of neuropsychology. So by the time we're full clinicians, we've had a lot of training in the area of neuropsychology, practicing, doing the evaluations, as well as performing other tasks, whether it be therapy or cognitive mediation or research or what have you, but we typically have a big background in these areas. So what is a pediatric neuropsychologist? Well, then it's somebody who specializes in working with kids. Simple enough. So here's a big question here. Why has my child's epileptologist been referred him or her for a neuropsychological evaluation? Well, there's a number of different reasons, and I'm just going to run through a couple of them right now. First of all, there's the idea of the pre-surgical evaluation. So in our group with epilepsy, certainly there's concern. Sometimes surgery is determined to possibly it might be warranted. It might be helpful for the child to get seizures under control. So in that case, a pre-surgical evaluation is done to give us an idea of what impact the seizures are having on the child's functioning, also to give us an idea of baseline, so we can see how the child's functioning now and then test them again after the surgery to see what kind of impact the surgery has had. So not only is the doctor interested in what impact the surgery has on the child's seizures, but also what impact it has on their functioning too. So if we have pre and post numbers, we can really get an idea of what kind of changes there have been. Now, second of all, there's issues of cognitive functioning. You remember I mentioned before that there are sometimes kids come in and there's issues with attention or executive functioning or language or memory or motor skills. So if parents or teachers have concerns about kids functioning in those areas, we can take a look at it. And it's more than just saying, that there's some issues in these areas. We can quantify that. We can determine really are there really issues going on here in those areas based on numbers. We get some data, and that gives us an idea of how a child is performing relative to their peers. So we can really get a sense of what their deficits and their weaknesses are, and that can be helpful for some other reasons, which I'm going to get into down the line, diagnostically and also coming with recommendations. I'll get into that in a second. Okay, another reason why a child might get referred for a neuropsychological evaluation is because if there are issues with their academic functioning, how they're doing in school. Maybe there's a history of school problems. Maybe there's a sudden drop in grades. Maybe there's some question about a learning disability. But certainly those are some issues not uncommon amongst kids with a history of seizures. So we might take a look there to see, well, if they are having problems, well, what's going on there? Is there a discrepancy that suggests that maybe there is a learning disability that could account for it? Are there other factors? Remember I said attention before, that's a big, big factor, where there might be issues in the school. Maybe there's comprehension issues. Maybe there's some sort of language issue getting in the way. Maybe there could be emotional behavior factors too. There's a lot of different reasons why there could be difficulties in the area of school. So that's why we did that comprehensive evaluation. And finally, behavioral issues tends to be a big issue, whether it's behavioral issues at home, oppositional behaviors. In some cases, therapy might be warranted, but maybe we want to fine-tune the diagnosis. Maybe repetitive behaviors or social difficulties that make us start thinking that maybe some sort of diagnosis on the autism spectrum might be appropriate. But either way, we're fine-tuning and get a sense of what kind of diagnosis is appropriate. So you can see there's a number of reasons why an evaluation might be referred to. Okay, so let's take a look at the next question here. What happens during neuropsychological evaluation? Okay, so this takes place in the office. It's done on an outpatient basis, and it typically takes place over the course of a couple hours. Usually the family will get a heads up in terms of a letter explaining how long to expect to be there, what the date is, who's it with, and what to expect afterwards. But again, let's talk a little bit about it right now. What happens during? Well, we start off with a comprehensive interview. Usually by the time a child's made it there, we've had a chance to look at the medical record, so that gives us a good idea of what their history is, what the difficulties are, and the reason why they've been referred in the first place. But an interview is always a good idea to get some more data, some more information. There might be questions from looking over all the records, or you just might want to know a little bit more. Either way, an interview gives us a pretty good idea of what the parents' concerns are, and not to mention also get what the child's concerns are. That's a good opportunity to talk to the child too and get a sense of what they think is going on and how they think they're doing. So certainly their level of insight is an important factor there too. Then there's the evaluation itself. Okay, at that point, it takes place over the course of a couple hours. And what kind of things are we doing here? Well, we're taking a look at different tasks. And there might be things like naming things or remembering things or drawing. There's going to be tasks typically that tap in academic skills, so things like oral comprehension and reading and writing and math skills. Typically we have questionnaires that the child fills out if it's appropriate to give us a sense of how they think they're doing. And those tap into those cognitive issues, not to mention the behavioral issues too, and then questionnaires that are completed by the parents and the teachers too, because usually we want to get a sense of how they're doing at home and at school, because how they're functioning in one place doesn't always mirror how they're functioning in the other place, and sometimes we see differences in how they're functioning. Not uncommon amongst parents for to say, they seem like they're a completely different person in one place versus the other. So we can want to get some data from both sorts of people. Okay, here's an important question here. Is this just an IQ test? Okay, a neuropsychological evaluation is certainly more than just an IQ test. An IQ test is typically part of it because we want to get a sense of what their overall level of functioning is, but it's more than that. Okay, an IQ test is going to give us a lot of data too. And I always try to caution people from putting too much stock into one score. One score is not going to give us a full idea of what a child's like, nor necessarily what their full potential is either, because one score can certainly get dragged down by a number of different factors that can happen during the course of the evaluation. Their level of attention, certainly level of focus can impact how their functioning is on different tests. Their level of rest, how comfortable they are. There's a lot of different things that can impact their functioning, with things that we try to address in the report too, the report which I'll get to in a little bit later on. But again, getting back to this idea, is this just an IQ test? Okay, again, the IQ test is part of it, because from an IQ test we can get a lot of information. We can get an idea about attention, processing speed, language, visual motor skills, things that we look at in other different ways too, other different tasks, but it's a good part, it's a good jumping off point. But a comprehensive evaluation is going to look at all areas of cognitive functioning: attention, executive functioning, language, visual, spatial, and visual motor skills, memory, levels of academic function and behavior. So we want to get as much information as we can. Okay, and again, one score in and of itself is not going to give us that much data. If a person struggles on one particular task, it's hard to generalize from that. We want to get a lot of data because we're more concerned about patterns. We want to see, does the child have difficulty, consistent difficulty in one area? And that gives us an idea that that is certainly something for us to take a look at a little bit more. Okay, let's take a look at the next question here. Do all kids get the same tests? Okay, a quick answer here, no. They don't all get the same test. Certainly there are some things that we tend to give pretty often, again, the IQ test and the academic tests, but the test that we give is determined by the referral question. Again, if there are questions about academics, we want to tap into their academic skills, and sometimes that's not an issue. If there's questions about autistic behaviors, we take a look at them in a different way. If there's questions about ADHD behaviors, we take a look at them in a different way. So not everybody gets the same tests. The tests that are given are determined by the referral question. Now, that said, even given that there are certain tests we give, there's different age-appropriate points that we start at. So we don't always give the same items within a particular test just to children. And that said, even when it comes to tests that we tend to give consistently, like things like an IQ test, there's different versions based on how old the child is. So you can see here there's a lot of variety here. So not everybody's getting the same thing. Here's a good important question here. My child's a little bit nervous about this. What can I tell them to make them feel better? Okay, not uncommon. You know, kids at this point have already been through a lot of testing, a lot of doctor's appointments, and the last thing they want is to go in and see another doctor. So what I try to remind them is that when we talk about neuropsychological testing, this has nothing to do with any kind of machines or taking any blood or anything like that. This is we are different kind of doctors, and we're doing different kinds of tests. There's things that are sort of like games. There's things that are sort of like puzzles. There's some stories. And some parts are a lot like school, again, with the reading and the writing and the math. There's even some drawing. Another thing that I try to tell them is to let them know that this is not the kind of thing that they can fail. The tests just aren't built that way. Typically, we want to see how far a child can get and how much a child can accomplish during a certain period of time. And again, this gives us an idea of what their strengths and their weaknesses are. It's just not the same thing as school or pass-fail. It's more just give us a sense of how they're doing and what kind of areas they're doing okay and what kind of areas they need help with. So really, that's the big thing to focus on, the idea that coming out of this, hopefully we'll get some answers as to what's going on and get them the help that they need. Because kids at this point are typically frustrated and they don't know what to do. But maybe we can get them the right resources to get them some help. Okay. Here's another important question. Can I be in the testing room during the evaluation? All right, typically we discourage parents from doing this. I certainly appreciate that parents want to be there because they think they might help calm them down, and sometimes that's necessary, at least in the beginning. But again, we try to discourage it. Why? Well, because parents can be, unfortunately, they can be a distraction in the room. No offense meant, of course, but just the fact of another person being there is a distraction, unfortunately. Second, sometimes parents can unwittingly point the child in the right direction, or maybe an answer can slip out, or say, no, look here, look there. So we want to try to prevent that from happening. That said, sometimes kids are so nervous and so scared that maybe they might join us for a task or two at the beginning. And then hopefully, by that point, the child will be comfortable enough so they don't really need them in the room anymore. And that's been my experience in the past. It's very, very rare that we have the parent be there for the whole time. Typically, kids are comfortable once they get a sense of what's going to be happening, especially when they see that this is a different kind of doctor and a different kind of test. Okay. Let's see here. How long is this appointment going to be? All right, this is a good question. The paperwork that you get typically tells people to plan to be here for the day. It can take up to like 4, 5, or 6 hours. Now, that's true. Now, in my experience, it typically takes more to like 3 or 4 hours. Why do we say 5 to 6 then? Well, because sometimes we need that much time, and that's okay. You know, some kids take longer. Sometimes there's a lot of things that we have to get done. Sometimes kids need a lot of breaks during the course of the day. There's a lot of different reasons why we might want to spread things out. Or we just might need that much time to get everything done over the course of the day. So we figure it's better to tell people, plan ahead to be there, just have the whole day set aside for it. That way we won't have to worry about rushing and trying to get done to get you off to another appointment to get back to school or what have you. It's just easier this way to plan on being there for the whole day. That way we have the time if we need it, and then we can get you out earlier if we don't need it. Okay. I just kind of covered this. Why does it take so long? We'll really be there for 5 or 6 hours. And do we get a break? Yeah, certainly. I covered those. Do we get a break? Typically, yes. Certainly we try to build in a couple different breaks during the course of it and add more as needed. It really depends on the child. Once in a while, I get a child who wants to go all the way through. We try to discourage that, but typically, we try and build in breaks because it just makes things easier. A little bit of breathing room during the course of the evaluation. Can we break it up into more than one appointment? Maybe. Typically we try to discourage this just because of scheduling issues. I know for myself, I'm usually scheduled like a good month, 2, 3 months in advance, and it's hard to try to schedule a second appointment. We can get really busy really quickly. Not only that, just trying to coordinate between the doctor's schedule and the patient's schedule can be really tricky. So that said, sometimes emergencies come up. Maybe sometimes, it might be a seizure that occurs during the course of the evaluation, and afterwards the child's just too tired to continue, in which case we'll try to work something out. Again, so generally the rule we try to discourage it, but we know that things happen, and sometimes we just have to. So we'll try to work with you. But again, there's good reasons why we try to keep it in one appointment. What should we bring the day of the appointment? That's a good question. What should we bring? Well, we try to tell people, we'll bring a snack or maybe some lunch, depending on where the office is. Usually there's a place to get lunch in the area. So, I know the other day, during a snow day, the deli that was nearby up in the Middletown office was closed, and that's usually our go-to place. So be prepared when it comes to that. Certainly medications that might be needed during the course of the day. But really what's most helpful for us are records. And what kind of records are we talking about? Academic records, if the child has any sort of 504 plan or an IEP, any kind of academic records in that regard that lets us know what kind of service that they're getting, that's helpful. It also gives us an idea of what kind of testing or evaluations have been done in the past, and that's helpful for us too. Okay, and consistent with that, any kind of evaluations that have been in the past, that's a good idea too, whether it's a neuropsychological evaluation or a psychological evaluation or testing that's been done during the school. If you have reports, that's helpful for us because we want to see what ground's been covered. And again, we're looking for patterns here. We want to see, is this consistent with, are our results consistent with what's happened before, or is this a sudden change? And then if it is, we want to get an idea, well, why is that? What's going on here? Okay. Why do I need to fill out all these questionnaires? Okay, this is more of a question during the course of the evaluation itself. You remember I said before, the evaluation, we try to be as comprehensive as possible. So when we're talking about being comprehensive, we want to do all the objective testing to give us a sense of how the child does on all these tasks. You know, we actually get some hard numbers, some hard data. But we also want to get a subjective sense because the questionnaires really give us an idea of what parents and what teachers see in their environments. And they can tap into some behaviors in a way that maybe don't necessarily come up during the interview. You know, the interview we try to be, again, as careful as possible, but sometimes things don't necessarily come up, and actually reading something can remind the parent, I forgot to mention that. And then they can endorse it, and we can talk about it a little bit more. But the questionnaires really fine-tune some of the behaviors and give us a good idea about what's going on there. So it is actually helpful. It really is helpful in terms of helping us come up with diagnoses and recommendations. Why do the teachers need to fill out the questionnaires? Really the same answer. That gives us a good idea of how the child's doing in both environments. Okay, what happens when the evaluation is over? This is an important question. What happens? Okay, well, we have to take all the material that we've done together at this point. We have to score it. Okay, what does that mean? We have all this sort of raw data, these raw scores. These tests are typically built on the idea of points, getting a certain amount of points on a certain task. We have to figure out, what does that point mean, that number of points mean? Is it average? Is it appropriate? Is it below average? Is it above average? And we determine that with the set of norms. And what norms are is basically a book of sorts with numbers and data in it that gives us an idea of where that number is for a child's age range. That is to say, again, is that score average? Is it below average or above average or so forth? Okay, then we can take all of that and put it together in the report and group it by different areas. So in a typical report, we're going to get a sense of overall functioning, attention, executive skills, language, visual, spatial, visual, motor skills, memory, behaviors, all these things that I mentioned back at the beginning. But we're sort of compiling all those tests that we did and putting them all together so you can get a sense of how the child is doing in a particular area. It's not just enough to say they had trouble on a task, but we see they had trouble on a number of different tasks in the area, then that starts pointing us towards the direction of something. Okay, so that's an important part. But then after that, we're going to get a sense of diagnoses and to get a sense of recommendations. And that all is filled out in the report too. Okay. Can you tell me how my child did afterwards? You know, as a parent, I can certainly appreciate it. I feel that, you know, right afterwards, people are typically feeling anxious and they want to know, you know, how their child did. It's usually a bad idea to give first impressions because you don't want to be wrong. You don't want to point the parent in a certain direction and then have to backpedal later on. It's better for us just to tell you how they did at the time of feedback. Maybe, you know, there can be some rough ideas. We can say, well, maybe they had a little bit of trouble in this area. But again, typically, it's better for us to sit down with it, really sit down with the work and think about it, take a look at all the numbers and take some time rather than come to some sort of rush judgment. Although, again, I do understand why. But really, the turnaround time, we try to make it pretty quick, which comes to our next question. When will the report be ready? Typically, the reports are ready in about 2 to 3 weeks, at which point feedback will be done. It varies from doctor to doctor in terms of how that's set up. I know for myself, I try to set up the feedback appointment at the time of the evaluation so that you'll know when the appointment's going to be, whether it's going to be in person or whether it's going to be over the phone. And we try to be flexible when it comes to that. I know for myself, in general, I prefer to do it in person just because it's easier to go over some things in person. But that said, we know that sometimes for parents it's hard to get another day off from work. So we try to work around you. If we need to do it over the phone, we'll do it over the phone. Now, if the feedback is done in person, certainly we can give the report right then and there when you come back for the appointment. If it's done on the phone, we typically get the report out that day and should get to you in a couple days afterwards. All right. Now, what does the report look like? Well, I kind of went over this already. The results are in a formal report broken down by areas. Again, the attention, executive functioning, language, motor skills, memory, behavioral issues, diagnoses, and recommendations. Usually a good-sized report's anywhere between 6 to a dozen pages, but it depends. It depends on what the referral question is. It depends on how many tests have been administered at that point. So your mileage may vary, so to speak. What do all these numbers mean? Well, you remember I said before, we get a lot of data, a lot of numbers from the evaluation. Typically in the back and in the body of the report, we'll talk about things like raw scores and standard scores and scaled scores and Z-scores. These are all stats. These all, again, it has to do with norms, converting a raw score to a standard score. The standard score tells us how the child did compared to other kids in their age range and their background. Now, that said, in the report we try to explain too what the numbers mean. So we'll use words like extremely low, which means the child had difficulty in that area, or borderline, which means it's an area of weakness, or low average or high average, which is generally appropriate, or superior, very superior, which just like it suggests means it's something that they did really well on. Or maybe we'll see something like clinical, which means it's something that it's significant enough to warrant us a closer look. Typically, we're talking about things like behaviors. They might be clinically significant. Okay, but that said, we really try to avoid just handing it. That's why it's important for us to have the feedback, so that you don't just have a bunch of numbers and don't know what they mean. So we can really go over what those numbers mean and spend some time with them and answer any questions that you might have. Are diagnoses given in the report? Yes, diagnoses are given in the report if they're warranted. Sometimes there is no formal diagnosis that's appropriate based on the data that we have, in which case that's fine. But sometimes diagnoses are given in the report, and typical diagnoses that we give are ADHD, or autism spectrum disorder, or oppositional defiant disorder, or specific learning disorder. These are the kind of things that tend to come up in our reports. But yes, so diagnoses are given in the report when they are warranted. Are recommendations given in the report? Absolutely. When we talk about recommendations in the report, we're going to try to cover a couple different areas. So first of all, if there's some questions about behavior, therapy might be warranted. So if therapy is warranted, typically a report will include some referrals based on the patient's area, that is to say, where they live, and hopefully insurance. So try to cover all bases when we can. Sometimes it's a little bit tricky to try to coordinate this, but we do try to give you some resources. When we're talking about behaviors, also things like books that might be helpful to read up a little bit more on the diagnosis that gives some strategies for dealing with, or maybe some websites, or maybe some other groups or support groups, things like this that might be helpful for parents. Okay, so that's one. When we're talking about academic issues, we're going to come up with recommendations for this school. And again, those are just recommendations. They're not in stone or anything like that. But having gone through this, we can get a sense of what has been helpful to kids in similar straits in the past, and also give the school a good idea of what we think might be helpful for them in the future. That is to say, different accommodations when it comes to testing, or maybe special education services or special education classes, different kinds of modifications. I've talked a little bit about this in the past in a previous talk, but typically this is all in the report. We also might give some strategies for home, things that they can do to work on their attention span, their organization skills, their planning skills when it comes to how to handle their homework and their schoolwork a little bit better. And then some strategies for parenting too, and how to handle, again, all the difficulties that the child is having, the things that have come up during the course of the initial interview. All right, we're getting close to the end here. What if I have questions about what's in the report? This is a good question. We try to handle as many questions as we can during the course of the feedback, and hopefully by the end of the feedback session, your questions have been answered. That said, once you get the report and you get home and you read it, you might have questions, and that's okay. That's our job, to answer the questions. So we're available, whether we have to do it through email or whether you have to do it on the phone or have an appointment to come back in and talk in person, that's okay. But either way, it's not supposed to be a one-time visit. The door is supposed to be open. So if there are further questions, we're there. We're there to answer them. Will I need to see another doctor now? It depends. Again, it depends on what the recommendations are. If it's therapy, yes, typically it would be a good idea to follow up with somebody else. Do we do that? Typically, the people doing the evaluation, we don't really do therapy too. Some of them do, but typically we refer out to see another therapist. Another doctor might be appropriate when it comes to medications, whether it's going to be back to the referring doctor, maybe the primary care, or maybe a child psychiatrist, in which case that might be appropriate. And it's always a good idea to follow up with the original referring epileptologist too. So yes, it depends on what the recommendations are, but sometimes you do need to follow up with somebody else, but to get some more services. Will you prescribe medication? Something that sometimes comes up in the course of the evaluation is we might say, well, medication might be helpful here. But we have Ph.D.s. We're not M.D.s, so that's not our particular area of expertise. We didn't go to school for that. We do know that medications can be helpful sometimes, and it's worth talking about with the M.D. So we always try to say, it's a good idea to go back and talk to the referring epileptologist, who in turn would probably refer out to a child psychiatrist. And again, these are people who specialize in the area of medication. We don't have prescribing privileges, so we wouldn't do that. What if I don't want my child on more medication? So again, another medication question. Again, something to talk about with the referring doctors, but in my experience, what we try to do when it comes to issues is think about strategies that might be helpful beforehand, before we have to go down that route, whether it's special education services or different strategies the child can learn on their own and practice on their own, or again, different accommodations of services in the classroom. Let's think about other things that might be done before we need to necessarily go down the route and consider medication. Who sees this report? Okay, that's a good question. Well, certainly the original referring epileptologist is going to see it, since he or she is the one who referred you to us. Certainly you, as the parents, are going to see it. The child is certainly welcome to see it. That's something I try to encourage parents to share with. If the child's there at the time of feedback, they're there. We can answer questions about that. Who else sees it? Usually the original referring doctor who referred you to our group typically sees it too. But who else? At that point, it's up to you. Typically, parents will want to share it with any kind of therapist that the child's seeing or is going to be seeing. Typically, parents want to share it with the school because it can be helpful for them getting services. But maybe back to the primary care physician if it takes us to keep a file on them. But really, it's up to the parent at that point to decide who's going to see the report. We really are not supposed to let that be seen by anybody else unless they're people that you want us to let see it. Do we have to come back? Certainly, you are welcome to come back. The door is open, and we welcome that. This isn't something that can be done on a monthly basis or anything like that, because of concerns about practice effects. If we do something too soon, the child might remember things from the last time that we did it. But it's not uncommon for us to do things on like a yearly basis, and that can be really helpful. Particularly when a child is having issues with school. If they're still having difficulties even after we did the evaluation, the accommodations are in place, well, maybe there have been some changes. If we do the evaluation again, we can see if there's been any changes in their cognitive functioning that might correspond to any changes in their life, whether it's continued problems with seizures, or maybe some sudden injury, or maybe there's some emotional or behavioral issues, and there's some sort of life events that might be contributing, and that can give us a better idea of what kind of recommendations are warranted at that point. So that can be really helpful to do an evaluation on a yearly basis. Not only that, but if we have the data from one year and we have the data for the next year, that's nice. That can give us a sense of comparison. We have the hard data there, so we can really get a sense of if they've stayed the same, or if they've improved, or if they've declined. And it's not just a matter of guesswork. We really can tell at that point using the numbers. And that can be helpful too in terms of getting services. Thank you. Okay, so that's just about, I went a little bit quickly today. That only covers about half an hour. That might have gone a little bit quickly today, but hopefully I covered all the questions that might possibly come up during the course of a neuropsychological evaluation for kids. So again, so overall, what is the point? It varies from doctor to doctor, but typically there's some concerns about the child's cognitive functioning or academic functioning or behavioral issues. What happens during the evaluation? Well, it's a series of cognitive tests that tap into a number of different areas, and typically there's some academics as well that we want to take a look at, not to mention some questionnaires that give us an idea of what the behaviors are like, if that's an area of concern, and those are filled out by the parents and or the teachers. What happens afterwards? We have to take all that information, score it, write it up in a report, and break it down by area, and also come up with some diagnoses and some recommendations. And what happens after that? Then we meet with the parents to go over the results, to really fine-tune it and to give them an idea of what's going on, what the child's strengths is an important part, and their weaknesses are, as well as the diagnosis and the recommendations, and hopefully to clear up any kind of lingering questions at that point. Okay. Well, I thank you for your attention. I apologize if I went a little bit too quickly. As ever, I am available if you have any questions. Certainly I can be reached through the group. Being very busy, sometimes it's easier just to get a hold of me through my email, which is rtrobliger, RTROBLIGER, at epilepsygroup.com. So if you have any questions or some concerns about an upcoming evaluation, please feel free to email me. And in the meantime, thank you for your attention, and I hope I answered all the questions that might possibly come up during the course of a neuropsychological evaluation. And that about covers it for today. Thank you.